College provides students with an array of new social situations and freedoms. With these new freedoms also come risks. 75% of people have had intercourse by the time they are 20. By the age of 24, 1 in 3 sexually active people will have contracted a sexually transmitted infection or an STI. Furthermore, 80% of these people will show no symptoms of an STI. STIs are communicable infections transmitted through sexual intercourse or genital contact. In the past, these infections had mostly been referred to as STDs or VD. In recent years, the term sexually transmitted infections has been preferred, as it has a greater range of meaning. A person may be infected and potentially infect others without actually having a disease. Some STIs can be passed through skin-to-skin contact. Others require contact with infected bodily fluids. STIs can be caused by viruses, such as the HIV virus that causes AIDS, bacteria, such as chlamydia and gonorrhea, while others yet can be caused by parasites, such as pubic lice or crabs. Making the choice to have sex automatically puts you at a higher risk for contracting an STI. However, there are some sexual practices that put you at greater risk of contracting an STI. Risky practices include having unprotected sex with casual partners or people unknown to you, with a partner who has unprotected sex with other partners, or after drinking or using drugs. All this chit-chat about STIs and their prevalence in young people might have you a little shaken, but we don't want you to swear off sex quite just yet. While sex does come with risks, it also has its benefits as well. Your high school sexual education teacher might have kept some of these surprising benefits off the syllabus, but we are all adults here, so let's get down and dirty. Sex does a body good in a number of ways, and each of the following benefits is backed by scientific research. Sex relieves stress, boosts immunity, burns calories, improves heart health, boosts self-esteem, improves intimacy, reduces prostate cancer risk, reduces pain, strengthens pelvic muscles, and helps you sleep. Now that we've covered the risks and benefits, if you choose to have sex, you must be proactive about your health. You can reduce your risk of contracting an STI by first, being in a monogamous and trusting relationship with someone who has been tested negative for an STI. Second, limiting your number of sexual partners. Third, consistently and correctly using a latex condom. Fourth, attending one of the Health Education Resource Center's Rubber Lovers presentations to learn about safer sex and safer condom use. Fifth, learning about vaccines that are available to prevent infections of HPV, hepatitis A, and hepatitis B. And lastly, avoiding alcohol and drug use when you choose to engage in sexual activity. You might be feeling overwhelmed with the amount of information it takes to have safer sex. It's good, it's bad, it's a lot of work. Lucky for you, there's a simple solution that can help you take control of your sexual health. What is the solution, you ask? Just ACT. ACT stands for Ask, Check, Tell. These 3 simple steps will help you cover all of your sexual bases. The first step in acting is to ask. A wise woman once said, if you're comfortable enough to be naked with someone, you should be comfortable enough to talk about STIs with them. Before you engage in sexual activity, it is of utmost importance to ask your partner if they have been tested for STIs recently, and what the status of their test was. With STIs, you can't always tell by looking, so you've got to talk about these things. If they haven't been tested recently, it's best to schedule an appointment to get tested and to hold off on the hanky-panky until you get the results back. You'll also want to ask your partner if they are in agreement in using condoms. While this may seem to be an awkward conversation, it is of great importance for both you and your partner's health. The second step in acting is to get checked for STIs. Getting checked reduces the uncertainty revolving around your STI status. A feeling of empowerment may result from being tested, because you are now in control of your STI status and your sexual health. Getting tested is also beneficial for not only your personal health, but your partner's health as well. While a positive STI test result would not be ideal, you will be able to take proactive steps to treat the infection and get healthy. Leaving an STI untreated and not dealing with the associated health risks is much worse than hearing a positive result. Because 80% of infected people do not show any signs or symptoms of an STI, it is important to get checked every 6 months. The final step in acting is to tell your partners or partner about your STI status and tell them to get checked. Being open and honest with your partner can help strengthen your relationship. If you test negative, you should be confident in saying so. However, if you test positive, it is not the end of your sex life. Telling your partner that you have an STI is the first step in protecting the both of you from risks. So how to start this conversation with your partner? While talking about STIs may not seem to be the ideal foreplay, it is an important conversation to have and indicates responsibility within the relationship. Now, what's sexier than that? The most important part is to be bold and to be yourself. If you are shy or nervous, simply say something along the lines of, I'm kind of nervous to put this out there, but I think it's important for both of us to get tested. Or you can say something like, getting tested before we have sex will protect the both of us. Why take a chance when we can know for sure? You can also stress the importance of getting tested by stating the facts. 1 in 3 sexually active people in the U.S. will contract an STI by the age of 24. So, you've overcome the awkwardness that may be associated with the talk. Now, what's STI testing all about? The test you will need can vary depending on your age, sex, sexual history, and which STI you are getting tested for. There is no one single test that can screen for all STIs. Your test may involve a physical exam, urine sample, tissue or cell sample, or a blood sample. However, most tests only take about 20 minutes, and some don't even require a blood sample. EIU's health clinic is probably the most accessible for students here on campus. All tests are $30 for males, but range between $30 and $45 for females. Making an appointment is easy and confidential. After getting tested, your provider calls you back with some alarming news. You've tested positive for an STI. Thoughts race through your head. What does this mean? Am I going to die? Have I infected anyone else? My sex life is over. Stop, relax, and breathe. A positive test result is not the end of the world. Remember, all STIs are treatable and many are curable. Your provider will supply you with ample information, antibiotics, and/or medication. It is important to follow through with provided medications and to share this information with any current partners. Taking action will allow you to take control of your sex life. Knowledge is power. It's your sex life. Take action. Get tested.